Good morning, everyone. March is Endometriosis Month. So this is the month that we are calling on the government to institute proper policy and action on endometriosis. It affects 1 in 9 women in Victoria. It costs Australia $10 billion a year. So any money that we spend on this will be offset by productivity and savings in acute health care. This is such a debilitating illness, and I'm joined here today by some incredible women who are absolute warriors for endometriosis to talk more about the need for greater research, to talk more about the need for a consolidated policy and action from not only the state government but the federal government, and also to talk about their own experiences with this horrible illness. So without further ado, if you'd introduce yourself, say your full name or whatever name you want to use.
Hi everyone, I'm Stanley and I'm the Director of Endo Foundation. And as Fiona said, 1 in 9 women and people in Australia are affected by endometriosis. It costs the individual $30,000 and the economy $10 billion, as Fiona touched on. But also there's a 6.5 year diagnosis delay. Now we know from research that any chronic pain condition, the sooner you get treatment, the better your outcome. So 6.5 years is far too long for people to be suffering with no understanding of what's going on and often being told that maybe it's in their head and maybe they're hysterical. A multidisciplinary endometriosis centre like Fiona is proposing would literally change the lives of so many people. Not only do they have to live with the stigma of a disease that is so under-recognised and under-researched, but they often have to find their own professionals, find the ones that are passionate and want to help them and manage their own healthcare. And the women and people that we talk to with Endo say that that is one of the hardest parts of their journey. So a space where all of those top professionals will work together to help that person and improve their health will literally change the lives of thousands of Victorians.
My name's Maddie Richards. I'm 26. I was diagnosed with endometriosis 4 years ago, but I started suffering when I was 16. There are times when I'm curled up in a ball on the floor because the couch was just too far away, and it feels like my stomach is full of broken glass, and it hurts to breathe, and it hurts to move, and I'm just stuck there. But it's not just the pain, it's also the fear. Is this going to be my life forever? Will it ever get better? Will I be able to have children? Endometriosis is loss. It's the loss of the ability to go where I want, when I want, and stay there for as long as I want. It's the loss of the ability to leave the house without taking a pack of anti-inflammatories or stick on heat patches. And the chronic nature of my condition didn't actually hit me until after my second surgery. I had to have endometriosis removed from a nerve bundle in my pelvis. And although that helped, it actually didn't clear up all of my symptoms, and I was left feeling powerless and hopeless and just stuck. And it felt like that was going to be my lot in life. It wasn't until a friend actually encouraged me to go and see a pelvic physio that I realised my care journey wasn't over and that there is more that I could do. I could be empowered and I could take control back from a disease that had affected so many aspects of my life.
Hi, I'm JD Hunter and I'm an endo warrior. I was first diagnosed at the age of 21, but I suffered symptoms from the age of 11. I'm now 41, so that's a good 30 years of living with this condition. I've had a total of 13 surgeries in that time. 5 of those were between 2016 and 2020. Out of those 5 surgeries in that time, 2 of my surgeries were misdiagnosed through the public system. Therefore, there was no explanation of my pain or symptoms, despite the fact that I had a long history of endometriosis. I was fortunate enough to find a fantastic specialist who understood my condition and referred me to a multidisciplinary team, such as acupuncturists, pelvic physios, and didn't just straight away go down the surgery path. The impact that this has had on me has meant that I have missed opportunities with my career, but also the choice to have a family or not. My last surgery was a total radical hysterectomy 15 months ago. It had come to that for to address the constant pain and bleeding that I was experiencing every day. It has taken a team of multidisciplinary specialists to provide me with the relief that I have today, which all endometriosis sufferers deserve.
Can I ask?
Yes.
If I can. Yeah, just how much, to use the term doctor shopping, do women have to do to find someone who understands what they're going through and to help them through it?
Oh, I don't have the numbers off the top of my head.
Just roughly, how much do you have to go through as a sufferer to find someone who understands what you're
Look, I would say I'm going to reflect on my own journey.
Sure.
Probably 10 to 20 doctors a year, and we're saying the average is 6.5 years, but lots of women and people that we talk to are seeing doctors for about 20 years before they get a diagnosis.
It's delayed diagnosis. Is it unique to endometriosis, or is it something that occurs in similar other diseases, or is there a big defining feature of it?
Delayed diagnosis is similar in some chronic pain conditions, and it's particularly prevalent in women's health issues because they're so underfunded and under-researched. The issue that we have with endometriosis is the only way to diagnose it is to use laparoscopic surgery. So we've got a stigma where it's really hard for women to talk to the doctor openly about the issues and how it affects their personal life and their menstruation. And we've also got the issue that it's laparoscopic exploratory surgery to do the diagnosis.
And how much awareness needs to be raised around endometriosis so that employers understand it, and that so people who are suffering it don't have to have difficult conversations with their employers about it?
Yeah, look, it's something that at Endo Help we're working around the clock to change. There is a lot of awareness. We need to completely end the stigma around anything to do with menstruation so that women can openly talk about their struggles, and employers and everybody can be there to support and understand that this is a real issue and it really is debilitating for everybody affected.
If I may, so if there are no supports from the doctor and there are the only way of knowing is laparoscopy, how did you how did you guess for the first time that it might be endometriosis?
For me, I was on a fertility journey and I was unable to get pregnant, and a doctor happened to say to me, "What are your periods like?" And I said, "Oh, actually, I can't work for the first 5 days every time I have my period." And she said to me, "Why haven't you mentioned that?" And I said, "Because I did about 15 years ago and I kept being told it was normal, so that's what I thought it was." So whilst there are doctors that don't believe you, there are also some really good doctors that are out there really trying to change this space. But unfortunately for sufferers, it's about finding that one that will hear you and do what is required.
Can I just add something to that? You know, as part of a good endometriosis campaign, we need to be looking at reproductive health leave for people with endometriosis and who are suffering from other reproductive health issues that many women would completely understand. We also did a survey where we had 1,300 responses, which is relatively uncalled of, and every single one of them told us how it really broke up their life. It disabled them from being able to reach their full potential in so many ways. And for many of them, it meant monthly calls to the emergency department. So this has to be a whole of government, whether it's period champions in schools, to help young women understand that what they're experiencing, like these women, is not normal. It's endometriosis.
Can I ask?
Yeah.
Oh yeah, just how much would this going to cost, and we're going to see a year, what are we going to kind of find a detail?
Get Pat to answer that. About the specialist centre.
How much would it cost
Yeah.
to run, do you mean?
How much are we looking for it? To set up a centre like this, it needs federal and state funding. So we're looking at joint funding of around $35 million. And that would set up the centre. There's also the Hudson Institute, which is doing some extraordinary work into inflammatory diseases, whether that's Crohn's disease or inflammatory cancers or endometriosis. And they're looking for around 14 million. Now, that will be completely offset by the savings in acute health and the increases in productivity.
Can you talk us through where your discussions are with Mr. Foley on this?
We are in that budget bid wish list space at the moment. So we have certainly put forward budget bids for an endometriosis policy, research and a specialist centre. But where that lands will be entirely in the government's hands.
And this specialist centre, will that see patients and also have research capabilities?
It will see patients, it will help educate doctors, it will help educate the public, it will help educate employers, and certainly it will do its own research, although I imagine it will be working with researchers not only in Victoria but around the world.
That's probably a bit early, but have you thought about
Where it could be like no. But, you know, women's health still is underfunded in Australia, and that needs to change. So wherever it is located, it probably still won't be enough. We will still need more. And with greater understanding that a centre of excellence can provide, I think that will open up the doors for further research and hopefully further funding.
Are there any other centres like this in Australia or overseas?
There are no centres like this in Australia. This would be an Australian first, and it's urgently needed. But having it here in Victoria, where we pride ourselves on our medical research and being the capital for medical research in Australia, it seems entirely reasonable that this centre be situated here.
How long would it take to establish, to get the funding?
Where there's a will, this can be done very quickly. You know, we've got researchers ready to do the work. We've got doctors ready to start helping people. There is absolute interest and passion for this. So now it just needs the money, and I would say this could be done very quickly. But I would say that I'm not in government.